But first, across the continent of Africa, a brain drain sends many of its highest skilled professionals abroad. But as Fred de Sam Lazaro reports from Uganda, one organization is trying to build a pipeline to keep medical professionals working in their native country. It's part of Fred's series, Agents for Change.
We're going to talk about what to do if you deliver a baby that's blue.
This class of 30 soon-to-be nurse midwives are training in Lira, in northern Uganda, a new university set up to address this country's severe shortage of trained medical professionals.
Usually, when you are resuscitating a baby, your adrenaline's going anyway.
Key members of the faculty are American volunteers with a program called Seed Global Health.
So it's all about the neck being in the right position.
Over the past 5 years, it has sent 184 medical professionals to 5 African countries, training nearly 14,000 students.
Each finger's like a C.
Emergency room physician Vanessa Carey founded the nonprofit.
If you look at sub-Saharan Africa, it has 24% of the world's global burden of disease and only 3% of the world's healthcare workforce with which to address that disease. That's a huge disparity.
Carey, who is the daughter of former Secretary of State John Kerry, first became interested in global health as a teenager when her father, then a senator, took her to Vietnam.
That trip was game-changing for me. I mean, just the absence of resources, no electricity, no running water, no shoes on kids.
In 2012, some 2 decades later, with degrees in medicine and public health, she founded SEED in partnership with the Peace Corps, sending U.S. doctors, nurses, and midwives for 1-year stints in rural Africa.
Go ahead and hold the baby.
Midwife Linda Jacobson from Olympia, Washington, served a year in Tanzania and is now in Uganda conducting specialized seminars.
There's incredible satisfaction about making what would be a small difference in the United States can make a huge difference in the lives of women and babies in these settings.
The curriculum, the first to offer bachelor's degrees, is meant to radically upgrade the way nursing is perceived and practiced in Uganda, to revive a profession that currently gets little respect and resources with predictable results, says Okaka Dokotam, Deputy Vice Chancellor of Lira University.
You have mothers who die in childbirth because of neglect, or nurses who are late. There is lack of kindness, and I see that a lack of professionalism. It's an ethical issue. And over and over, we talk to our students and say, we want you to do something different.
This is your first?
Third-year student Patience Nafula says the clinical experience has already given her fulfilling experience, recalling one new mother's deep gratitude after a difficult delivery.
I talked her through it. When I came back the following day, she knelt down for me. She knelt.
She knelt down before you.
That really touched me, and I knew from that moment I can make a difference.
The emerging crop of nurses and midwives have been trained under conditions that would be considered normal in the West or in private clinics here. Things like access to clean water, stable electricity, adequate supplies. The problem is these basics are far from guaranteed in much of the workplace they're going into, especially in rural areas. Lira University's Dokotam does worry that Uganda's public health system is not yet fully equipped to absorb the new, highly skilled graduates.
It's like having a Ferrari and then just going at 20 kilometers per hour, you know? So it's going to take changing policy. We will have to try to influence policy to make sure that room is created for this new cadre of nurses and midwives.
Jeffrey Odong would certainly like to see that policy change. The recent graduate from the SEED program is interning at a public hospital and says he often feels resented for his higher-level skills. He's allowed mostly to just observe, he complains.
What we were trained on, we are not being allowed to practice.
So you could be doing much more than you are doing?
Absolutely.
For its part, the SEED Global Health Program faces a threat of its own. The Peace Corps recently announced it would exit starting this fall, citing a change in its approach to such partnerships. The Corps declined our request for an interview.
I'm really, really proud of what we've done, and I am frustrated.
Dr. Carey blames the Peace Corps decision on politics and says the resulting cutbacks will force a significant scaling back from 5 countries to 2, including Uganda, and far fewer American medical volunteers.
There's been I think a real concern around global health funding, a worry that global health funding is going to be at risk.
As she and colleagues regroup and seek other funding, Uganda's healthcare system must contend with a different kind of threat: poaching. Well-trained nurses are in high demand in the West, Middle East, Gulf states, and elsewhere in Africa, where salaries and working conditions are far better than in Uganda. As university officials and advocates work to improve conditions here, students such as Patience Nafula face a fraught personal dilemma.
I prefer being here. If we have everyone go out, who will then stay to help our country? The temptation is there. There is better pay, the resources are there. Why not go? Why stay? So that's the challenge.
The challenge for Uganda will be to improve its healthcare system and coax students like these to stay and work here, particularly in rural areas. It's estimated that 1 of every 4 midwife positions in the public health system is unfilled. For the PBS NewsHour, I'm Fred de San Lazaro in Lira, Uganda.
Fred's reporting is a partnership with the Undertold Stories Project at the University of St. Thomas in Minnesota.